Vaccines or immunizations are going to be injections, or they can be oral solutions, or they can actually even be nasal mists now that can be administered to patients. And they're basically a part of a virus or a bacteria that's either been killed or it's just a piece of it so that the body can recognize it and mount an immune response. Vaccines prevent a whole lot of diseases. Tetanus can be prevented by vaccination. You have measles, mumps, rubella, pertussis, which is also known as the whooping cough, diphtheria, polio, rotavirus, pneumonias and ear infections can even be prevented with your PCV vaccines and your Hib vaccines. You have vaccines against the annual flu, and then you have vaccines if you're going to be traveling. It's really important to keep our children healthy. The immunizations are going to help prevent school absenteeism, which of course is then going to help the parents so that they're not missing days of work. These immunizations are protecting children against preventable diseases that can have serious consequences, leading to hospitalizations or sometimes even death. Really, when you're choosing not to vaccinate your children, you're taking a risk. It's just a roll of the dice with their health. We have these vaccines available for these preventable illnesses, and you're risking that they can get sick. You're also risking the health of your community, because when more people choose not to vaccinate and the vaccination rates fall, then you have the risk of outbreaks for things such as pertussis and measles that we've seen in groups. I just want the parents to feel very open and ready to discuss with their provider what their concerns are. I always ask for an open discussion. I want to answer their questions with my medical knowledge. And I want them, when they're looking for information, to go to reputable sources. Places like the American Academy of Pediatrics, the CDC, ACIP are all great sources where they can go and get information that is evidence-based and scientific. Vaccines are safe, they're effective. We vaccinate millions of children in the United States every year, and the serious side effects are really rare. So if you have questions, please reach out to your pediatrician.